program does not necessarily reflect the views of News Radio 830 KHVH, its staff, or management.
Live from downtown Honolulu, it's The Moving Body with your host, Dr. Bernie Portner of Portner Orthopedics, recognized as Hawaii's leading sports medicine and orthopedic specialist. And now, here's your host, Dr. Bernie Portner.
Your host today and every day at this time to take your calls and try to answer your questions regarding arm, leg, neck, or back. I'm on the board myself, so there may be some technical hitches, but here we go. The number here, and today is August 4th, 2012. The number here is 521-8383. If you're calling from a neighbor island, then we have a toll-free number for your convenience, 1-888-565-8383. The lines are open now. It may not be soon, so if you have a question for me regarding arm, leg, neck, or back pain, sports-related injuries, work or car accident-related injuries, health or fitness questions, it's a good time to call, 521-8383. Otherwise, if you don't have a question, you're welcome to just join the listening crowd, which I'm sure is 99% of you. But this show works because people call. And when they don't call, I tend to do a monologue and try my best not to ramble. A couple of quick announcements. The clinic, as those of you who listen to the show or come into the clinic, my clinic over on Pi'ikoi Street and also in Kaneohe on Kamehameha Highway is going through major changes for the better, but changes that are not painless. And we appreciate everybody's patience in terms of our new systems. But the worst is behind us. Things are really falling into place. And I'm most appreciative to Tony, our office manager, and the whole staff that have put up with all this, and the patients themselves who also had to be somewhat inconvenienced to start with. But this coming week, we're going to be implementing finally our new EMR, electronic medical record system, and patients will be able to log in to a patient portal from their home, check their appointment, register, fill out questionnaires, and things will be a lot more efficient, hopefully. Let's go ahead and take our first caller. Dave, go ahead. You're on the air, and thanks for calling.
Yes, when I flex one of my feet, it gets real sore. Just at that time, it's not sore the rest of the time. And I wonder if I have plantar fasciitis.
When you say flex, you mean point your toes downwards or bring your foot up toes towards the ceiling? When
I'm walking, when I put weight on it, the rest of the time it doesn't bother me.
And when you say you put weight on it, are you talking about your heel or the ball of your foot?
It's just forward of the heel. Sometimes when I'm standing, right under the heel, the very bottom of the heel is a little tender too.
It could be. That's the right location for plantar fasciitis. Typically, a very common complaint with patients who have plantar fasciitis is that they hurt worst first thing in the morning when they get up and hobble to the bathroom. Is that you?
Yes.
Well, then likely you nailed it. It probably is plantar fasciitis. I can't say without examining you. How long has this been going on?
About 2 weeks.
2 weeks isn't that bad. Is it getting worse or?
No, it's getting better. I've been taking analgesics.
Yeah, and you might want to cut back on your walking time if possible. There is very good physical therapy for this. There's exercises you can learn to help not only get rid of this episode, but try to prevent it from recurring. It's a common condition. Occasionally people come to me not after 2 weeks, but after 2 months or longer. And sometimes I have to give a shot. But bottom line, this is, if it is plantar fasciitis, this is very treatable. If it isn't plantar fasciitis, it's also probably very treatable, but we would have to see. Other possibilities include stress fracture, tendinitis, a joint problem in the midfoot. There's tendinitis. There's various other options, but if you have pain first thing in the morning at the worst, and then pain on the bottom, just forward of the bottom of your heel with walking, does it tend to get worse as the day goes on?
No.
Uh-huh. That, too, is typical of plantar fasciitis, so that's one little bump in your story. But if it's going away, it might be, and it's only been 2 weeks, and it doesn't incapacitate you, I take it. You go about your business?
Yes, I walk and probably with a slight limp, but I can still tolerate it.
When you say walk, you mean to the bathroom, to the car, or you mean go for a walk?
Every day to get some exercise.
Well, I would tell you this, that although I'm the first guy to encourage daily walking for exercise, if you have this, it might be a good idea to back off and get an alternative exercise in the meantime, like stationary bike or swimming, something that doesn't stress this fascia too much and lets it heal a little quicker. And then you can later gradually resume your walking. But in any case, you seem to be getting better, so maybe not that critical.
Should I try to stretch that muscle?
It's not exactly a muscle. It's a thick sheet. It's a thick sheet of fascia, which is just connective tissue connecting the ball of your foot to your heel. And yes, stretching it is part of the treatment, but you don't want to overdo it. So be careful about being too vigorous with that. There's a time for stretch, and there's a time not to stretch. You know, I see you're over on the windward side. We have Dr. Shepper over there if you need someone to help you with this. Right now, though, it's not bad advice just to cut back on your walking, take your analgesic, do a gentle stretching, and see if it doesn't go away. And then in a week or two, if it's still a problem, maybe go see Dr. Shepper over there at the clinic on Kaneohe.
Thank you, doctor.
All right, thanks for the call. I appreciate it. Let's see, we'll take our next caller, Jim in Kailua. Jim, go ahead. You're on the air. And
Hi, doctor. How you doing? Hey, what's your opinion of that kinesiology tape?
You know, a lot of people love it. My therapists use it a lot. I think it has a purpose and a useful role. I don't think it's a panacea. Of course, I don't think anything is a panacea. It's not always effective. It's never a standalone treatment. So, you know, you don't want to go to a therapist, tell them you got this tendon, they put this tape on, and you're done. So it's never a treatment all by itself, standalone kind of treatment. But it has its place, and it's withstood the test of time. It's been around for quite some time now. You certainly see it on Olympic athletes, so that's quite an endorsement. They wouldn't be using it if it didn't seem to be helping, I don't think. So, yes, I endorse it, but I don't want to see it as the only treatment available or the only treatment applied. It should be in conjunction with other, perhaps more direct treatments to the lesion.
Mm-hmm. Okay.
But it certainly can help.
Yeah, well, you gave me the 5 shots in the knee, and that seems to have worked pretty good.
Oh, that Hyalgan for osteoarthritis.
Yeah,
I love that treatment. Not that it's a cure. We don't have one yet for osteoarthritis, but man, oh man, I get plenty of positive feedback, and sometimes in a year I have to repeat it, but it's worth it because otherwise people walk with pain, and with it they don't. So.
Yeah, well, I put some of that tape underneath the kneecap, and that seemed to help even a little bit more.
Good.
But the shots really did work good for me, so thank you for that.
That's good to hear.
But I just was curious what your professional opinion was of this stuff.
Yeah, you know, I personally don't apply it. I have therapists who use it all the time. My wife, who's a pretty high-level athlete, she likes it. She uses it for various aches and pains.
Okay.
And we certainly see it on TV when we watch the Olympics all the time.
They look like they're painted with it.
Yeah. Right.
Okay, well, thank you for your opinion, Doc.
Have a good weekend.
Take care. Make it good. Bye-bye.
Yeah, bye-bye. Let's see, another caller, Stephen. Stephen, go ahead. You're on the air, and thanks for calling.
Oh, yes. Thank you, doctor. I'm having problems with vertigo and ataxia.
Yes.
Okay, and my bones are healthy, but I broke both clavicles, and my balance comes and goes, and I've had 3 MRIs, and the doctors are telling me vertigo and ataxia, but they don't know where it's coming from.
Right. And you're talking about doctors. You're talking about neurologists, neurosurgeons.
Neurologists, yes.
Yes. And how long has this been going on?
3 years.
Does it seem progressive? Is it getting worse?
It comes and goes when it wants.
Do you have any other symptoms in terms of neurology? You know, blurred vision, weakness, double vision?
Yes, the CT showed up a silent stroke, but I don't know what a silent stroke is because I never experienced one.
Yeah, but I asked you if you had other symptoms like double vision, blurred vision, numbness.
Yes.
Where?
Yes.
What?
Yes, in my hands.
What do you feel in your hands?
Numbness, pins.
And does that go away also?
Yes, but that only happens when I sleep on my side.
That might not be the thing. You know, I'm not exactly a neurologist. Just for the listeners so they know, vertigo is the sense of spinning or dizziness that you get like when you're a kid and the kids put you in a swivel chair or something.
Yes.
Close your eyes and spin you around, and then you try to stand up and you feel like you're on a ship and the room is spinning. That's called vertigo. Ataxia is incoordination, and it's generally a cerebellar problem, a portion of your very primitive brain. Not you personally, but everybody's we have a primitive part of our brain, and we have a more recent part of our brain. The cerebellum controls balance, helps control balance, and also the back of the spinal cord, the posterior columns, also have a great deal to do with balance. And ataxia is, for example, if you drink too much and you get stopped by a cop and they ask you to walk a straight line, not that I would know this personally, but I've seen it in movies. They ask you to walk a straight line and you kind of can't do it. A drunk walks with ataxia. So just to explain, vertigo is a dizziness with the room spinning. Ataxia is, I guess simply put, is a drunkenness and an inability to walk straight, for example. And when you have these things and they come and go, there's several possibilities. I don't know. Has anyone talked to you about MS?
Not yet, but 3 MRIs and 2 CTs. But the doctor, he put his hand on the back of his neck at the base of his skull when he explained it to me. So,
well, I don't know, over the phone, and I'm not a neurologist, so even in person I might have trouble, but over the phone it's kind of hard for me to say, but this is likely a central nervous system disorder. Central nervous, meaning brain, spinal cord, brainstem, that kind of thing. But it could be separate. It could be you have a vertigo from some sort of ear problem and middle ear problem, and it could be that you have your ataxia from something unrelated. The two don't have to be related. I said the word MS, and I don't say it as a scaring.
Yes, I wish not.
Yeah, MS is multiple sclerosis. I have no idea if that's what this is, but multiple sclerosis is a degenerative disease of the central nervous system, and it's characterized by multiple lesions in time and space. And what I mean by that is you get multiple lesions, different neurologic problems. Ataxia is one, vertigo might be another, numbness in the hands might be another, blurred vision might be another. In time, in other words, it comes and then it goes, and then later on,
when it wants to,
it comes back, and then in space, we already talked about that. One is in the cerebellum, one might be in the spinal cord, different areas. But you never know about multiple sclerosis until several different symptoms come and go.
Oh, geez. She mentioned the pituitary gland also.
Yeah, so I don't say that because I think you have it. In fact, I don't think you have it, but it's a topic that comes up with your symptoms, and you're seeing a neurologist. They're the guys that are going to figure this out. Nothing over the phone. They're going to help you figure it out. And in the meantime, don't fall. How did you break your clavicles?
Oh, motorcycle wreck.
Oh,
both clavicles, not just one, both.
That's a different story. That's unreal.
Yeah.
That's unreal.
I live on Kaneohe, and your office is on Kaneohe.
Yeah, it is.
Should I come visit?
Well, you can, but like I say, what you mostly need is a neurologist, and
I'm with.
I'm not one, so it's probably not something I could do a better job of than your neurologist. I'd be happy to see you, but it's probably not your first choice. If you're not happy with your neurologist, you could always see another.
Well, I've seen 3 so far.
And nobody's given you a pinpoint diagnosis?
A definitive answer, no.
Nobody's given you a definitive answer, and it may not be achievable. You know, sometimes people have problems that can't be diagnosed.
Oh, jeez.
Yeah, but how are you now with your symptoms coming and going?
It comes and goes when it wants. Sometimes I use a cane now. I wasn't a walker, and physical therapy brought me to the cane.
So do you walk in a ataxic fashion right now?
No, I have to look at the ground to watch where my feet go.
Yeah. I don't know that I can help further over the phone, I'm afraid, Steve.
Yeah. So I was wondering if I could come in.
Like I say, it's not exactly up my alley, although it sounds like I know what I'm talking about. But it's just stuff I remember from school, but it's not exactly my field. I deal with orthopedics.
Thank you for being honest.
So this is neurological. And also, one other thing you might consider doing if you haven't already is to see an ear, nose, and throat specialist.
I have
and they can help sort out perhaps the vertigo.
Because I asked the doctor, I says, how long is this going to last? And he says, 2 weeks, 2 months, maybe forever.
Yeah, we don't know. Until you know the diagnosis, it's hard to describe the prognosis.
Okay, yeah.
All right, Steve?
Thank you for listening to me.
You bet. Good luck with this.
Okay.
Bye-bye. 521-8383. If you just tuned in, welcome to The Moving Body. My name is Dr. Bernie Portner. I'm an MD specializing in the diagnosis and non-surgical treatment of painful conditions affecting the limbs and spine. Not just painful, but numbness, weakness, loss of function. And I'm your host every Saturday at this time, taped from 6 to 7, and then live like now, August 4th, live from 7 to 8. And the lines are suddenly empty. So if you have a question for me regarding shoulder pain or back pain or sciatica or buttock pain or knee problems or elbow problems or neck pain or wrist pain or hand numbness, anything like that, it's what I do. It's what I live for. To quote a famous line in a movie that my kids watched about 1,000 times when they were kids. Anyway, I have on my little list of things to try to cover today a topic called shin splints. I saw a young high schooler, a young lady who ran track or runs track in high school, and developed pain in the front of her shins that she only felt when she ran, and then when she rested, it went away. And by definition, those are called shin splints. And like so many other terms that are confused, are confusing, shin splints is not a diagnosis. Yes, it's something that you have, but it describes your symptom. Pain in the front of the shin with exercise relieved with rest. But there's several possible causes of shin splints. I can list them, the obvious ones, quickly. A stress fracture of the tibia, the shin bone. That can hurt with exercise and is relieved by rest. So some people have shin splints, but that's their symptom, but their diagnosis is of stress fracture of the tibia. Another a common cause of shin splints is a tendinitis in the front of the shin. That'll hurt with exercise, and the pain will go away with rest. So that's shin splints caused by a tendinitis. Another common cause of shin splints is a muscle tear in the front of the shin. That, too, will hurt with exercise, running, for example, and be relieved with rest. So all of these three things, and there are more, all of these three examples are correctly called shin splints, but shin splints doesn't really tell us enough. It doesn't tell us what tissue is actually injured. And shin splints also have a typical onset. That is, there's never a sudden onset. It's always a gradual onset. It starts out real little and goes away real quick. And if the exercise, the running or whatever, continues, then it seems to come on more quickly and more strongly and last longer. And these symptoms progress. And then soon it hurts just to walk. Not even running is necessary. You can just walk and feel it. And then I've seen cases where people actually, because they've ignored their body's signals and continue to run through the pain, they actually hurt even with rest sometimes. And I've even seen a case, this was very dramatic, where a dedicated runner, or should I say fanatical runner, or should I say a zealous runner, but a runner that was overly enthusiastic and wouldn't quit no matter what, ran through her shin splints and ended up, and it was a stress fracture of her tibia, and she ran so hard through the stress fracture that she actually suffered a fracture. It broke, like you snap a pencil, like you think of a broken bone. That's what happened to her tibia because the stress fracture symptoms were ignored. Exercise was continued, in the spirit of no pain, no gain. And she ended up close to a finish line in a race, actually snapping her tibia and collapsing in excruciating pain to the ground. And I was a witness to that. I was, in fact, in charge of the medical tent. It was, I think, a 10K race, but back in the 80s. And it's something I'd never forget. It's very vivid in my mind. 521-8383. If you have a question for me regarding arm, leg, neck, or back pain, give me a call. You can check us out online, PortnerOrthopedic.com. We also now have a Yelp account and are on Facebook. For those of you listening and want to check out our website or give us a Yelp, that would be very cool. I'm going to break here for the news, but while you're listening to the news, if you have a question for me regarding arm, leg, neck, or back pain, it'd be a good time to call, and then right after the news, I could take your call right away. Don't go away. Let's listen to this, and I'll be right back.
The News Authority in Honolulu is News Radio 830 KHVH.
It's 75 degrees, partly cloudy in Honolulu. I'm Julia Norton-Dennis. Here's what's happening. Iranian state TV is blaming terrorists or Syrian rebels for the kidnapping of 48 Iranian pilgrims from a Damascus suburb today. The bus, filled with Iranians, was headed to visit a Shiite shrine. Iran is a close ally to the Syrian regime. No one has claimed responsibility for an attack on two ships off the coast of Nigeria's oil-rich southern delta early today. Two of the country's Navy sailors were killed. 4 foreign oil workers were kidnapped. The attack happened in a region that had seen relative calm over the past few years. Firefighters are on the scene of a building fire in Salt Lake. The fire is reported at 7:01 a.m. in the Salt Lake apartments on Alailima Street. When the first units arrived, they reported smoke seen. Reinforcements were called, but they were returned when it was apparent the first companies could handle the situation. Police are handling traffic in the area. Police have opened an attempted murder case after a 15-year-old boy was taken to a trauma center in serious condition with stab wounds. It happened shortly after 4 a.m. on Honolulu Street in Kapolei. A 34-year-old woman also suffered minor injuries. Police have a suspect in custody and recovered a knife at the scene. A 34-year-old man who was struck by a van while crossing Kamehameha Highway in Pearl City Thursday night has died from his injuries. The man was taken in critical condition to the hospital shortly after the 7:30 p.m. crash. He died last night. The 36-year-old driver of the van that struck him was not injured. Police don't know if speed, alcohol, or drugs were factors. sunny, breezy, high in the upper 80s tonight, mostly clear, low near 74, and tomorrow sunny. Currently in Honolulu, 75.
You're listening to Dr. Bernie Portner on The Moving Body. Hope you're enjoying the show. If you have a problem with your arm, leg, neck, or back and are somewhat afraid or too shy to call, just call my office, 596-7300, and make an appointment to see one of us live and in person. Otherwise, call here at 521-8383, and we'll try to answer your questions. Thanks for listening, and let's get on with the show. Okay, here we are back live. Thanks for hanging in there, and I have a caller already. Andy, go ahead. You're on the air, and thanks for calling.
Hi, Dr. Portner. Real quickly, I have this foot pain in my right foot. I'm a physician myself. It's over the dorsum of the right foot, a little above the outer edge of the midfoot. And what happened was about a year and a half ago, I kicked the golf ball in frustration. And ever since then, it's been sore, and it's been about a year and a half, and it still hurts. It hurts sometimes to walk. It hurts sometimes to push on the distal lateral part of the right foot. It's only on the dorsum. It's not on the bottom. It doesn't really hurt when I wiggle my metatarsals or the foot bones, but it does hurt if I walk on it. I've never had an X-ray, which I probably should, but I'm just wondering if you have any ideas of why it would be hurting a year and a half later.
And did it get swollen when this first occurred?
It did a little bit, yeah. Not too much, but a little bit swollen, but not dramatically.
We're talking about the top of your foot, the dorsal,
Correct.
not the bottom. And
Correct.
yet when you walk, it doesn't hurt on the bottom, it hurts on the top. And lateral is the outside by the baby toe side of the foot, just so I have a picture. And,
right.
And you have a long metatarsal before the toe, and you have a joint, the metatarsophalangeal joint, and then approximately you have the tarsal-metatarsal joint. Is it over either of those?
It's probably over the distal part of the metatarsal, over the fourth or fifth metatarsal, the distal portion.
I see.
Before the cuboid, before all those funny small bones in your foot, right.
Right. And I'd have to examine you, but on the top of your foot, you have tendons, so you could have a chronic tendinitis somehow. You could have fractured a bone somehow, and it never healed properly. We don't know because you never took an X-ray. It could be one of the joints, either the tarsal-metatarsal, the fourth or fifth ray, or distally, the metatarsophalangeal joints, although I'm not sure. But it shouldn't be that difficult to diagnose just with a careful physical exam and perhaps an X-ray. So after a year or more, I would say, doctor, it's probably time to not heal yourself, but have someone look at it. Whatever it is, it's likely diagnosable and then readily treatable. It's just over the phone, and it's a little bit tough, and it's not that typical, especially that it doesn't hurt on the bottom.
No, it only hurts where I actually kicked that golf ball, that one spot.
But what do you mean? You kicked the golf ball with the side of your foot?
Yeah, basically I dropped the golf ball and I kicked it with the top of my foot.
Oh, with the top of your foot, and it's been sore ever since.
Right.
This is the revenge of the golf god.
That's right, exactly.
This is something you probably deserve, you know, according to the golfing. If you look it up in the rule of golf.
Right.
This is
Don't ever kick the golf ball.
The good news is that I think it's only a 3-year term, so you're 2/3 of the way. You're halfway there.
Okay, great.
No,
so
but I think it is if it's, let's say you crushed, you know, there's tendons and some of the tendons there are in sheaths. So let's say you caused a tenosynovitis or a tendinitis. That could be a chronic condition that could respond to things like friction massage or a corticosteroid injection. If you damaged the periosteum and bruised it and maybe even developed a chronic hematoma between the periosteum and the bone due to the impact of the golf ball, that could be chronic and painful. Do you feel a bump anywhere a tender bump anywhere right where the ball hit you?
No, I actually don't feel any type of bumps.
There's
or
no
anything,
deformity or anything like that.
No.
So, yeah, gosh, it should be something that's readily diagnosable. And then once diagnosed, as you know, treatment is usually pretty obvious.
Right. Okay, yes. Yeah, I feel like it's time to get another opinion other than mine.
There you go. Just to make you feel better. I'm 62, and I haven't seen my internist for over 3 years.
There you go.
I just don't know. They say every year by now you should be getting certain exams and certain tests and so on. But
yeah,
basically. I feel good. I don't know.
Okay. Well, great. Thank you, Dr. Portner.
Okay. Thanks for the call,
Thank
Andy.
you.
Yeah.
Have a good day. Bye-bye.
You too. Bye-bye. Let's see. It's always flattering when a physician calls, and more often they call either with their own complaint or sometimes with a difficult case that they're worried about. But doctors know that they've arrived or that they're old when doctors start asking them for other doctors, younger doctors start asking them for advice. 521-8383. You don't have to be a doctor to call in. In fact, generally the callers are not physicians. 521-8383. If you're on a neighbor island listening to the show, hello. And we have a toll-free number, 1-888. That's 1-888-565-8383. And there's plenty of time left, I think. Yeah, we have another 20 or 25 minutes to go, so I'll be taking plenty more callers. I wanted to talk a little bit about osteoarthritis, not to be confused with osteoporosis, which it often is. They have little or nothing to do with each other. Osteoarthritis is the most common condition affecting the joints. We call it osteoarthritis because on X-ray at least, we see typical bony changes that we don't see in other types of arthritis. And it gets the term osteoarthritis. The arthritis implies that there's inflammation in a joint. This has other names like degenerative arthritis or post-traumatic arthritis. Some people call it a wear and tear arthritis. It affects very commonly the knee, the hip, and less commonly the shoulder and other joints. It also, of course, affects the joints of the spine. When we see a patient with, let's say, osteoarthritis of the knee, the complaints are that I have trouble getting out of a chair, I have trouble getting out of the car, I have trouble walking, going up and down stairs, and there are several good treatments for osteoarthritis, which is to say there are no great treatments for it, because when there's one great treatment, all the other not-so-great treatments we stop using. I'll talk a little more about it, but I see I have Sally from Maui waiting. Sally, thanks for your call. You're on the air.
Thank you.
What's up?
I had a question about, I don't know if you watch TV ever, but they have the Tommy Copper, their support. You can get them for your knees or your elbows.
I haven't seen that, no.
You haven't seen it? Okay.
No.
And then I had another question about...
Well, what was the question, by the way?
Well, the question is, does they weave copper into the fabric?
I see. Yeah, forget about it.
Forget about it.
Forget about it. Do they say it cures hoarseness also?
No.
I see. Because I have a drink of water right here that cures hoarseness. No, but copper... put on your body, or magnets put on your body, or titanium put on your body. It's all hocus pocus. It's all just for the naive that they want to sell you something. And people who suffer and people who have conditions for which there's no cure, like certain types of arthritis, they are especially susceptible to be preyed upon by the hawkers of TV to say, buy this and this will help you relieve your pain. And if you believe it enough, It might, because there's a placebo effect, and there's the effect of prayer and the effect of positive thinking. So, and then there's also the natural course of things. A lot of aches and pains go away anyway. So someone has a problem, puts on some copper, and feels better next week, and they say, aha, this copper really made me feel better, but it might have just been the natural course of things. But there's very few things that I am sure about in this world, and especially in this world of medicine, but this is one of them.
Have you ever heard of the spirulina adicona, the astaxanthin?
Yes, I've heard of that.
So what do you think about that?
I think that there's more science to that than there is to copper. Yeah, I think this whole new biotech industry that's trying to come up with safer and what we sometimes refer to as natural, anti-inflammatories and natural antioxidants. And I think there's something to that. Okay. I'm no expert on it.
Well, I just bought 5 pounds of it, and I'll let you know.
Yeah, let me know how it
and
let me know how that copper works out for you too. So.
Well, I don't know. I thought,
you haven't bought that yet, have you?
Braces, because they're a lot cheaper at Long's Drugs. Because I use them as knee pads actually, in case I spill off my bike.
Yeah.
So.
Well, I guess that part's good.
Yeah, I don't want to get my knees scuffed up.
And do you wear a helmet when you ride your bike?
Yeah, fully loaded. I got gloves, helmet, knee pads,
the
whole shot.
I love that. I have a beautiful young lady working for me, rides her motor. She doesn't wear a helmet.
This is a bicycle.
I know. I'm just upset. Anyway, Sally, thanks for the call.
Thank you.
I appreciate it. Take care.
Bye.
Let's see. I have another caller. Tiffany. Tiffany, go ahead. You're on the air, and thanks for calling.
Hi. About a year ago, I had a ganglion cyst removed from my left wrist.
Yes.
And the surgery went fine, no real problems. Didn't get to finish the physical therapy. Yeah, shame on me. And then all of a sudden, the pain that was associated with trying to put pressure on it, because I'm in the military and I have to do push-ups.
Yes.
That finally went away, and then I started playing volleyball, and then all of a sudden the pain is back.
Is the ganglion cyst back? Can you see it?
No, the pain is back. I'm not sure if the cyst is back.
And is the pain identical to that which you had when you had your cyst?
Yes.
Well, cysts do recur, so it might be. But eventually, is it on the top of your hand, the opposite of the palm?
Yes.
And if you bend your wrist down so that your palm approaches your forearm, does it pop up? Does a little cyst start to pop up? That's usually when you can see it.
Well, that was the other funny part of it. My cyst didn't protrude like that because it was further down, I guess, into the tendon.
Oh, I see.
So they had to actually do an MRI to actually see it.
I see. And then they surgically removed it, and you did well afterwards.
Yes.
And you were able to do push-ups and play volleyball and all those things?
Well, I was able to do the push-ups, and then the pain came back once I started playing volleyball.
But in your mind, you're pretty convinced it's the identical symptoms that you had before.
Yeah, when I put pressure on it to do push-ups, now it hurts again.
And it's the same exact place?
Yep.
As far as you can tell.
Yeah, as far as I can tell.
Right. It's unusual, by the way, to have a ganglion cyst not seen on physical exam, only seen by MRI and then surgically removed. But if that's the story, that's the story. You might need to go back and have them relook at it. I would need to examine you, but it may be something simpler. It might be a joint problem or a tendon problem. Maybe something less than surgical can be tried, like an injection or friction massage or other forms of physical therapy.
Okay.
But you got a problem, don't you? Because you have to do push-ups to take your tests.
Yes, I do.
Yes, you do. So, I guess go back to the same people and say it's coming back. And then maybe they'll repeat their MRI. And if they say, maybe we should go back in, ask them if there's some alternative non-surgical treatments you might try first before you jump back into surgery.
Okay. You have time for one more question?
Yeah, go ahead.
Sure. Okay, other part of the body, my right shoulder.
Yes.
Whenever I put my hands behind my back, as if to do one of our military stances, say we call parade rest.
Yes.
After about 5 minutes, I cannot stand it. It's so much pain involved with that, where I can't literally put my hands behind my back and say, like, wrap my fingers if I needed to just hold my hands behind my back.
Yes.
So I don't know if it's being aggravated because I tend to sleep on my side, and maybe now it's just finally caught up with me.
And when you say behind your back, you mean like behind your waist?
Behind my, yes, that's
not
a good way
up,
to put it.
not up by your shoulder blades.
The pain is actually in my shoulder blade.
But
right
where's your hand when you're just described this?
It's the small of my back.
I see, and that's a certain parade rest.
That's what we call it. Yes.
Posture, and that after 5 minutes hurts you in your shoulder blade.
Yes.
On that right side. And do you have any neck problems if you twist your neck around this way and that?
Not that I noticed, no.
Because the most common cause of shoulder blade pain comes from the neck, but this doesn't sound like it's one of them. And are there any other activities throughout your day that you do that cause your shoulder or shoulder blade to hurt besides this parade rest business?
No.
That's the only time.
Yes. I guess I can note that it does start to feel like my fingers, like my pinky little finger goes numb after a while, too.
In that same position?
Yep.
Huh. Well, I don't know. I don't know over the phone. I probably could figure it out in person, or if you see a proper orthopedist or neurologist, they could probably figure it out. There's something called thoracic outlet syndrome that this comes to mind, although I'm not giving you that as your diagnosis, but that would be on my differential list of possibilities. You could just have a simple shoulder joint problem, and when you put it in that position, it causes both pain and numbness.
Okay.
Those are two things that come to mind at the top of my head, but it requires a proper physical exam and a careful scrutiny, and it can be figured out. Is it something you have to do often?
Not so much now that I'm up in rank, but no, but certain times of the year, it's done a lot more than others.
Right. I would have it checked out.
Okay.
All right, Tiffany, and thanks for your service.
All right. Thank you for the help.
You bet.
Have a good one.
You too. Well, let's see, 521-8383. Neighbor Island listeners can call toll-free 1-888-565-8383. I forgot to drop that line. I'm learning. Let's see. We have another 10 minutes or so plenty of time for one or two more calls. I'll be happy to try my best to answer your questions. Before this last caller, I was finishing up with my little spiel about osteoarthritis. And I was saying that there are several good treatments for it. Anti-inflammatory medications help. Simple Tylenol helps. Watching your weight helps. Some people claim that glucosamine helps. Certainly physical therapy to improve the strength and range of motion of the joint clearly helps. If you have fluid in the knee, we can take that out, and that feels better. Sometimes almost all the time, putting cortisone in the knee joint, or in the osteoarthritic joint, can be very, very helpful. There's a treatment called, what I use is hyaluronic. It's hyaluronic acid. And that is quite effective. Sometimes people have it so bad that they have to have surgery, and they actually have a new joint put in and the old one taken out. And when there's a long list of treatments, and this is what I was trying to get at, when there's a long list of treatments for any condition, it means that none of them are great. You get that? So when I give you 4, 5, 6, 7, 8 options, to treat osteoarthritis, you can conclude and conclude correctly that we don't really have a curative treatment for osteoarthritis. As soon as we do, that'll be the only treatment we use, and we can forget about all the rest. You won't need pain pills. You won't need shots. You won't need to take medicines. You'll just take whatever it is they figure out and fix it, and that'll be the end of it. I don't know if that's coming anytime soon, but my point is that throughout the history of medicine, there are always a lot of treatments for conditions until they find the cure, and then they use it, and they forget about all the rest. You know, tuberculosis, they used to send you up to the mountains, and they used to collapse a lung, and they used to do all kinds of things, and then they discovered the tuberculous bacteria and a drug to kill it, and we could forget the mountains and the collapsing of the lungs and all the rest, and we just gave antibiotics, and that's it. Same with pneumonia. I guess tuberculosis is a type of pneumonia, but my point is that once a cure is found, the list of treatments gets a lot shorter. And when there's a long list of treatments, it means that, yeah, some of them may be good, some not so good, but none of them are the final answer. And that's unfortunate. But in the meantime, we have to do the best we can, and the best we can includes various combinations of all of these things. And even though there's no cure, we have ways to manage. And management, the goals of management for osteoarthritis or any orthopedic problem, is to minimize the pain and maximize the function. The function, you know, when you have arthritis of the knee, the functions that are difficult are walking and stooping and going upstairs and getting out of the car and getting up from a chair. Those are functions that are made difficult when you have osteoarthritis of your knee or your hip. And with treatments, we can help restore normal function and minimize the pain. And it might take shots, it might take pills, it might take therapies, it might take rest, it might take surgery. I don't know, but something has to give so that you can go up and down stairs again, and you can walk again, and you can get out of chairs and get out of cars and do whatever it is that we who have normal joints don't even think about because we take it for granted. Who thinks about what a gift it is to be able to walk upstairs? And yet those who can't do it are severely hampered. Where do you go? Where's the elevator? Well, how do I get up there? I guess I might have to stay home. I don't want to go there. Function is the name of the game. And until we find a cure for osteoarthritis, we just have to make the best out of a bad situation, and that's basically what I do. 521-8383, maybe time for one more caller. In the meantime, I'm often asked questions like this. Doctor, I have blank, and you fill in the blank. Let's say low back pain. What do I do? And what do you do? What's the answer to that? What do you do for low back pain? And I could answer it in two different ways, at least. One is to say, well, why don't you try some of this, or why don't you try some of that, or why don't you go take Pilates classes, or why don't you lose some weight, or why don't you take some aspirin, or why don't you lie down for a couple of days, or, you know, I could make some treatment suggestions. But actually, because lower back pain can be caused by a variety of different diagnoses, and each diagnosis, for the most part, requires a different approach, a different treatment. The answer to the question, doctor, what do I do for low back pain, is always find out what's causing it, and then you'll know what to do about it. So it's not fair to call me and say, doctor, I have a neck pain, what should I do? The answer will always be get a diagnosis. I hope I made that clear. Let me take probably what's going to be my last caller, John. John, thanks for calling. You're on the air.
Sure, Dr. Portner. Thanks for taking my call. I have a question regarding my son injured his shoulder, and it was, I guess, diagnosed as a tendon strain, and that he has some tendinitis.
Yes.
And he's been going in and having therapy on it for about 3 weeks or so. It hasn't gotten any better. Should we be concerned that it could be some type of tear, or how would you know? Is there a way to just say, like,
yeah? How old is your son?
20.
And how was this diagnosis made? Was it a careful physical exam? Was it a fancy test? What was done to your son before the diagnosis was concluded? What was done?
It was by a physical therapist.
A physical therapist had a look, got a shoulder pain. You got a tendinitis.
Right.
So I don't know, of course, over the phone, but the diagnosis is suspect because it wasn't. It could be correct. And then which tendon? Because there's several, like 6.
Okay.
So which tendon is it? And how do you know it's not a bursitis or a capsulitis or arthritis? How do you know it's not a labral problem? There's a lot of possibilities. And depending on the diagnostic skills of the examiner, in this case, the physical therapist, it can be quite a suspect in terms of, is this really what your son has? Plus, is your son getting better?
No.
Okay, so whether the diagnosis is correct or not, the treatment doesn't seem to be working. So I think you want to get another opinion. See a sports specialist or an orthopedic specialist or a non-surgical orthopedist like myself. Have it examined again, have it re-diagnosed. If any tests are required, have the test done. And once the diagnosis is clearly confirmed and established, in other words, more precisely, tendinitis of which tendon, for example, or the tendons aren't involved. I think it's a bursitis. I think it's a capsulitis. I think it's something else. And then the treatment is likely to be more accurate and more effective.
Okay.
So I guess there's room for concern on your part. 3 weeks is long enough. And if an orthopedist or a diagnostician hasn't examined it and given you another opinion on the diagnosis and effective treatment, you need to move on.
Okay.
All right, John?
One last one. What would an MRI do?
It can show the tendons. It can show the tendinitis, but it's not a substitute for a careful exam.
Okay.
All right, John. Thanks for the call. Have a great weekend.
Bye-bye.
That's about it, everybody. I'm going to sign off here. I want you all to get out there and have some fun. And happy birthday to my daughter yesterday. Talia, I love you. Take care, everybody. We'll see you next week. Thank you for listening to The Moving Body. Hope you enjoyed the show. Remember, if you're having problems with your arms, leg, neck, or back and would like to get an appointment over at the office on Pecoy Street, you can give us a call, 596-7300. We're open 6 days a week and have a full line of doctors, therapists, EMG, and a great office staff to assist you. We try to respect your time like we hope you respect ours, so people are seen on time. You don't have to expect to spend the whole morning if you have a 9 o'clock appointment. We'll try to see you right then and there. Remember the warning signals that I talk about throughout the show off and on. If someone tells you that it's only your age to live with it, that the x-ray's normal, nothing's wrong, that it's, quote, arthritis or bursitis or tendinitis, but they haven't really examined you very carefully, be cautious about that. Ask for another opinion. If you're told to have surgery, ask for another opinion. If you're told nothing else can be done about it, you want to say, well, maybe you can refer me to another specialist. Maybe they have a better idea. Don't just accept those kind of things. Don't forget to tune in next week, same time on KHVH. Go out there and exercise this weekend. It's the single most important thing you can do for your health and body. Health cannot be bought off the shelf. Special nutritional supplements is not what it's going to take to improve your health. It's going to take a lifestyle change. It's going to take for you to put on some good walking shoes and get out there and take a walk every day. We'll see you every